Narration: Macrobid is an antibiotic that is used to treat bladder infections, also known as acute cystitis. It works by stopping the growth of bacteria. It is important to note that this medication only treats bacterial infections and will not work for viral infections such as the common cold or flu. Using antibiotics when they are not needed can cause them to not work for future infections. It is also important to mention that this medication should not be used in infants younger than 1 month old. Additionally, it should not be used to treat infections outside the bladder, including kidney infections such as pyelonephritis or perinephric abscesses. As for the daily dosage and optimal timing, it is best to follow the instructions provided by your healthcare provider. Remember to take Macrobid by mouth with food as directed by your doctor, usually twice daily, about 12 hours apart. It's best to swallow the medication whole for the most effective results. Avoid using antacids that contain magnesium trisilicate while taking Macrobid, as they can interfere with the absorption of the medication in your system. To get the best results, take this antibiotic at the same times every day. This will help you remember to take it consistently. It's important to continue taking Macrobid until you finish the full prescribed amount, even if your symptoms improve before then. Stopping the medication too early could cause the infection to come back. If your condition doesn't improve or gets worse, be sure to let your doctor know. If you experience nausea or headache while taking Macrobid, it's important to consult your doctor or pharmacist. This medication is prescribed because the benefits outweigh the risks for most people. However, some potential side effects to watch for include dark yellow or brown urine, which is usually harmless and temporary. But it's important to seek medical help if you experience dark urine along with symptoms like persistent nausea or vomiting, abdominal pain, or yellowing of the skin or eyes. Other serious side effects to watch for include severe headaches, vision changes, signs of infection, and unusual muscle weakness. In rare cases, Macrobid can cause lung problems, so it's important to seek medical help if you experience symptoms like a persistent cough, chest pain, or difficulty breathing. Additionally, this medication may also lead to a severe intestinal condition, so seek medical help if you experience persistent diarrhea or abdominal pain. If you experience a severe allergic reaction while taking Macrobid, seek medical help immediately. And if you notice any other side effects, it's important to consult your doctor or pharmacist. Before taking Macrobid, make sure to inform your doctor or pharmacist about any allergies you have, as well as your medical history, especially if you have kidney disease, liver disease, G6PD deficiency, lung disease, numbness/tingling of the arms/legs, vitamin B deficiency, mineral imbalance, blood disorders, diabetes, ongoing weakness due to long-term disease, certain eye disorders, or if you are an older adult. It's important to note that this medication may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using Macrobid before receiving any immunizations/vaccinations. If you are pregnant, Macrobid should only be used when absolutely necessary, and should not be used near the end of your pregnancy or during labor and delivery, as it may cause a certain blood disorder in your baby. It is also important to consult your doctor before breastfeeding while using this medication, as it can have undesirable effects on nursing infants. Be sure to check the How to Use section for instructions on how to properly take Macrobid. It's important to be aware of potential drug interactions with Macrobid, as they can affect how the medication works and increase the risk of serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Remember not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Macrobid include certain drugs used to treat gout, such as sulfenpyrazone. Additionally, Macrobid may interfere with certain lab tests, such as certain urine glucose tests, which can lead to false test results. It's important to inform lab personnel and all your doctors that you are using this medication. When taking Macrobid, be sure to follow the prescribed dosage and schedule. It's important to take it at the same time each day to maintain a consistent level of the drug in your body. If you have any concerns about the timing or dosage of Macrobid, consult with your doctor for guidance. If someone has taken too much Macrobid and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share Macrobid with others, as it has been specifically prescribed for your current condition. Do not save it for later use in case of another infection, unless your doctor advises you to do so. While taking Macrobid, you may need to undergo lab and/or medical tests to monitor your kidney and liver function, blood counts, and bacterial culture. If you are prescribed Macrobid for an extended period of time, such as several months or more, your doctor may also recommend lung function tests. Make sure to attend all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Macrobid, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next one at the usual time. Don't take a double dose to make up for the missed one. Make sure to store Macrobid at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of Macrobid, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal methods when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.